What if the body could quietly tell you when time is running short, months before anyone realizes it? It may sound surprising, but many older adults begin showing signs that they are approaching the final year of life well before anything feels urgent. These changes aren't loud. They don't come with alarms or flashing lights. They start subtly, in small shifts that are easy to overlook. A little weight loss here, a bit more fatigue there, a growing tendency to sit in silence. At first, it all seems like part of normal aging. But what if it's not? For many families, the truth only becomes clear in hindsight. After a loved one has passed, they look back and say, "Now that I think about it, we did notice the signs. We just didn't know what they meant." That's why this message matters. Recognizing these quiet signals ahead of time doesn't change the outcome, but it changes everything about how you walk the path. It gives you a chance to plan, to connect, and to be present in a way that brings peace instead of panic. This video is not about fearing death. It's about understanding life's final chapter and embracing it with clarity, compassion, and care. We're going to explore 5 subtle but powerful signs that often appear in the last year of life. These aren't dramatic medical events. They're gentle shifts that, if noticed early, can help you make the most of the time you have left with someone you love. Whether you're caring for a spouse, a parent, a close friend, or even preparing for your own aging journey, this knowledge is a gift. It helps you avoid regret, it helps you focus on what truly matters, and most importantly, it allows you to support your loved one with dignity and grace. So if you've noticed changes lately, small ones, that don't quite feel right, stay with us. Because the signs are there. And when you understand them, you don't just watch the end come. You walk beside your loved one with intention, love, and peace. Sign 1: significant weight loss. One of the first and most telling signs that an elderly person may be approaching the final year of life is unintentional weight loss. It usually doesn't happen all at once. It starts quietly: a belt that suddenly needs a new notch, clothes that hang a little looser, or a hearty appetite that begins to fade. At first, families tend to brush it off. "She's just not that hungry lately. He's probably just eating lighter now." It's easy to chalk it up to normal aging. But here's the truth. Losing weight without trying is rarely a harmless change in older adults. In fact, it's often a signal that something deeper is going on inside the body. As we age, it's normal to lose a small amount of muscle over time, but when that loss happens rapidly, it could mean the body is no longer processing nutrients the way it used to. The digestive system may slow down. The body may stop absorbing protein effectively, leading to muscle wasting and weakness. And when that happens, daily movement becomes harder. Energy fades, the immune system weakens, and the person becomes more vulnerable to infections and injury. This type of weight loss can show up in small ways that are easy to miss, like needing to pull a favorite chair closer to the table, taking shorter walks, or feeling winded after basic activities. Even subtle changes, like a loved one pushing food around on their plate, leaving meals unfinished, or preferring liquids over solids, can be quiet red flags. Another major factor behind weight loss is a declining appetite. Many elderly individuals simply stop feeling hungry the way they once did. Their sense of taste dulls, food stops being enjoyable, and they may begin skipping meals or eating just a few bites at a time. This isn't just a preference, it's often a biological change. When the body senses that it's starting to shut down, it sends fewer signals to the brain to seek out food. The result? Less eating, less energy, and a downward cycle of decline. Sometimes underlying medical conditions are also to blame. Conditions like cancer, heart failure, and kidney disease can quietly progress for months before obvious symptoms appear. Depression and early cognitive decline can also cause someone to lose interest in eating. When the body isn't getting the fuel it needs, it slowly begins to shut down, physically, mentally, and emotionally. Families often respond to this change with love and care, encouraging their loved one to eat more, offering favorite meals, or supplementing with high-protein shakes. These efforts are kind and well-meaning. But when weight continues to fall, despite these attempts, it's important to recognize that the issue may not be about food at all. It may be about the body preparing for its final stage. In this phase, forcing large meals isn't always helpful. In fact, it can be uncomfortable or even stressful for the person. A more compassionate approach is to focus on comfort, hydration, and foods that are easy to chew and swallow. Think soft textures, small portions, and offering meals at times when your loved one feels most alert and willing to eat. If you notice someone you love is losing weight without trying, especially if they're eating less, feeling weaker, or having trouble staying active, don't dismiss it. This isn't just about how they look. It's a message from the body, and one worth listening to. Recognizing this sign early gives you time to adjust expectations, bring in support, and shift the focus from fixing to caring. Because when we understand what's really happening, we can stop worrying about pounds and start focusing on presence, peace, and the time we still have together. Sign 2. Extreme fatigue and physical weakness when even simple tasks feel overwhelming. Another powerful sign that an elderly person may be in their final year of life is a deep and persistent sense of fatigue. This isn't just the normal tiredness that comes after a long day or a poor night's sleep. It's a kind of exhaustion that doesn't go away, even with rest. At this stage, things that used to be simple, getting dressed in the morning, walking across the room, preparing a meal, can start to feel like mountains to climb. For some, even sitting up in bed or holding a conversation becomes too draining. You might notice that they nap more often during the day, fall asleep mid-sentence, or struggle to stay awake during meals or visits. It can be jarring to witness, especially if this person was once full of energy and independent. But this kind of tiredness is the body's quiet way of telling you something important. It's starting to conserve energy for only the most essential functions. As the body prepares for its final transition, multiple systems begin to slow down. The heart may not pump as efficiently, blood circulation weakens, and muscles get less oxygen and nutrients. Over time, this leads to a gradual loss of strength, stability, and stamina. Even someone who was walking unassisted just a few months ago may now need help standing, bathing, or moving from room to room. And that shift, both physical and emotional, can be incredibly difficult for them to process. Another key contributor to this kind of fatigue is the body's natural metabolic slowdown. In younger years, our bodies convert food into energy to power movement and activity, but in the later stages of life, that system begins to slow. Instead of fueling motion, the body begins redirecting energy inward, focusing only on preserving vital functions like breathing and heart rate. That's why your loved one may sleep more, stay still for longer periods, or seem checked out at times. It's not laziness or disinterest, it's the body preparing itself gently for what's ahead. You may also notice sudden dips in energy throughout the day. One moment your loved one may seem alert, and the next they are completely wiped out. Even small efforts, like standing up, talking on the phone, or brushing their teeth, may feel like too much. And it's not just physical. Fatigue at this level also takes an emotional toll. Many older adults who have always taken pride in being independent may begin to feel embarrassed, ashamed, or even depressed about their growing limitations. They may stop engaging in conversation, avoid visitors, or lose interest in their usual hobbies, not because they've stopped caring, but because they simply no longer have the energy. This can create a cycle of isolation and sadness. Sometimes, well-meaning family members misinterpret this fatigue as laziness, or they might encourage their loved one to keep moving or just try harder. But pushing someone who is truly exhausted can unintentionally cause guilt, frustration, or even harm. The reality is this: pushing through exhaustion won't help at this stage. What matters most now is listening to the body's needs, respecting its new limits, and allowing space for rest. Small, gentle moments, like a soft conversation, playing calming music, or simply sitting quietly side by side, can be far more meaningful than trying to maintain old routines or force activity. If you notice someone you love is experiencing deep, ongoing fatigue that isn't relieved by sleep or rest, take it seriously. This isn't just getting older. It's often a sign that the body is entering a new phase, letting go of its energy reserves with intention and care. By recognizing this sign early, you can shift from trying to restore lost strength to instead offering presence, patience, and peace. Create a calm environment, speak softly, offer help without pressure, and above all, remind them that they are not defined by how much they can do, but by who they are and how deeply they are loved. Sign 3. Cognitive confusion and emotional withdrawal. When the mind begins to drift. As the final chapter of life approaches, some of the most noticeable and often most emotionally painful changes don't happen in the body, but in the mind. A loved one who was once mentally sharp, socially engaged, and full of personality may begin to show signs of confusion, forgetfulness, or emotional distance. These changes can be subtle at first, but over time they become increasingly difficult to ignore. You may notice that someone who once remembered every birthday now struggles with names or dates. They might forget where they placed common items, ask the same question multiple times in a single conversation, or become disoriented in familiar surroundings. They may lose track of time, become easily distracted, or suddenly seem unsure of how to complete everyday tasks. These shifts are often not just normal aging, they may be early signs that the brain is no longer functioning the way it once did. What's happening behind the scenes is often related to reduced blood flow and oxygen to the brain as the heart and circulatory system begin to slow down. The brain, like every other organ, depends on a constant supply of nutrients and oxygen. When those supplies decrease, cognitive function begins to decline. That can lead to memory loss, mental fog, trouble focusing, and moments of confusion or even fear. One particularly difficult aspect of this decline is its unpredictability. There may be moments when your loved one seems perfectly lucid, telling stories, laughing, or engaging in conversation, only to become suddenly confused, quiet, or withdrawn minutes later. These changes can leave family members feeling disoriented and unsure of what to expect from one moment to the next. Alongside confusion, you may also begin to see signs of emotional withdrawal. Someone who used to enjoy family gatherings, favorite TV shows, or chatting on the phone may now prefer to sit in silence or spend more time alone. It's not because they've stopped loving you, it's that their emotional processing and social energy have changed. The brain, under strain, begins to prioritize rest and simplicity. Stimulating conversations or noisy environments can become overwhelming or exhausting. For many, it's simply easier to retreat. This withdrawal can take many forms. Some people may appear calm but distant, while others become unusually irritable, anxious, or easily upset. Mood swings, unexpected tears, or sudden frustration are all common. And for family members, it can feel like losing someone before they're truly gone. The most important thing to understand is this: these changes are not a choice. Your loved one is not trying to push you away. They are not being rude, difficult, or forgetful on purpose. Their brain is doing the best it can as it adapts to a body that is slowly shutting down. So what can you do? Start by meeting them where they are. Instead of correcting their memory or trying to bring them back to normal, try to provide a sense of calm, familiarity, and reassurance. Speak gently. Use their name. Make eye contact. Keep surroundings simple and comforting. Familiar photos, soft lighting, a favorite blanket, quiet music. You don't have to fill the silence with words. Sometimes, the most powerful way to connect is simply by sitting beside them, holding their hand, or smiling. They may not remember what you said, but they will remember how you made them feel. Routine can also help reduce anxiety. Eating meals at the same time, keeping daily activities consistent, and avoiding overstimulation can bring a sense of security. If your loved one becomes upset or confused, try not to argue. Instead, redirect the conversation gently. Validate their emotions and offer comfort. If you're noticing these signs, more forgetfulness, confusion, withdrawal, or mood changes, try not to panic. These may be signs that the mind is starting to follow the body's path toward letting go. Recognizing this shift early gives you the chance to adjust your expectations and start focusing on what really matters, creating an environment where your loved one feels safe, respected, and unconditionally loved. Because even as the mind drifts and memory fades, the heart still remembers love. And in the end, that quiet connection, your presence, your patience, your touch, can bring more peace than any conversation ever could. Sign 4. Frequent infections and slow healing when the body can no longer fight back. Another quiet but significant sign that an elderly person may be approaching the final stage of life is a noticeable increase in infections and a slower healing process. You might start to notice that someone who rarely got sick is now battling colds more often, recovering more slowly, or experiencing one minor illness after another. At first, it may seem like bad luck, just a stubborn bug going around or a lingering cough from last week. But when these infections become more frequent and harder to recover from, it's often a sign that the immune system is weakening. As the body prepares for its final chapter, many of its defense mechanisms begin to shut down. The immune system, which once fought off viruses, bacteria, and small wounds with ease, can no longer respond as effectively. Infections that were once minor now take a toll. Antibiotics may stop working as quickly, recovery times grow longer, and the body's ability to bounce back starts to fade. Common infections in the final year of life include urinary tract infections, UTIs, pneumonia, skin infections, and oral infections. What makes these more dangerous in elderly individuals is that they often present differently than they would in younger adults. Instead of running a high fever or complaining of pain, a senior might simply seem more tired than usual, less responsive, or more confused. In fact, a sudden change in mental alertness is often the first sign of infection in older adults, far more common than a cough or fever. Another concern is wound healing. A simple scratch, a bruise, or a pressure sore may take far longer to heal or may reopen repeatedly. Poor circulation is often to blame. As the heart becomes less efficient, blood flow to the skin and extremities decreases, making it harder for oxygen and nutrients to reach the tissue. This slows healing and increases the risk of infection. For individuals who are bedbound or have limited mobility, the risk of pressure ulcers and chronic wounds grows even higher, especially if they are not repositioned regularly or given proper skin care. For loved ones and caregivers, watching this process unfold can be incredibly difficult. It's natural to want to fix the problem, maybe with another round of antibiotics, a new specialist, or a hospital stay. But at a certain point, the goal may need to shift. Instead of trying to cure every infection, the focus turns to comfort, care, and reducing suffering. That might mean keeping the person well hydrated, maintaining good hygiene, and making sure they're clean, dry, and comfortable. It might mean choosing soft bedding, adjusting their position frequently, and using gentle lotions or ointments to prevent skin breakdown. You may also begin working more closely with a palliative care team or hospice nurse, who can provide support, monitor symptoms, and help manage discomfort in ways that don't require hospital visits. It's also important to include your loved one in decisions when possible. They may prefer to stay home rather than be hospitalized again. They may want rest, familiar surroundings, and time with family more than aggressive treatment. Listening to their wishes, when they are able to express them, can bring peace to everyone involved. It's important to remember that frequent infections aren't just an inconvenience. They're the body's way of signaling that it no longer has the strength to fight. And while that truth can be hard to face, it can also be freeing, because once we stop trying to battle every symptom, we can start truly caring in a deeper, more meaningful way. So if your loved one is facing recurring infections or healing more slowly than before, take it as a sign, not of weakness, but of transition. This is the time to provide comfort, warmth, and love, to hold their hand, to ease their discomfort, and to let them know that they are not alone, no matter what their body is going through. Because in this final stretch of life, presence and compassion matter more than any prescription. Sign 5. Major changes in breathing or circulation. When the body begins to slow its rhythm. One of the clearest signs that an elderly person may be nearing the final stage of life is a noticeable change in how they breathe and how their blood circulates. These changes can start subtly, but over time, they often become more pronounced and more difficult to ignore. You may begin to notice that your loved one's breathing becomes slower, shallower, or irregular. At times, they may take long pauses between breaths, or their breathing may suddenly speed up, then slow down again without explanation. In some cases, this change takes on a distinct pattern known as Cheyne-Stokes respiration, a rhythmic cycle where deep breaths are followed by periods of no breathing at all. Though this can be alarming to witness, it is often a natural part of the body's slowing process and doesn't necessarily signal pain or distress. Shortness of breath may also become more frequent. Even minor movements, like sitting up, turning in bed, or speaking a few sentences, may leave them feeling winded. You might notice them breathing through their mouth more often, needing to stop mid-sentence to catch their breath, or even expressing feelings of tightness in the chest. Lying flat may become uncomfortable, and they may begin to sleep in a recliner or propped up on several pillows to ease the strain on their lung. These symptoms are often due to weakened lung function and fluid buildup in the lungs, which can occur as the heart struggles to circulate blood effectively. This fluid can cause a persistent cough, gurgling sounds while breathing, or a rattling noise, sometimes called the death rattle. What might seem like a lingering cold or chest congestion is often a sign that the lungs and heart are struggling to maintain internal balance. Circulation changes are another major indicator. As the heart slows, the body begins to prioritize blood flow to the most vital organs, like the brain and heart, while reducing flow to the skin and extremities. You may notice that the hands, feet, or even the tip of the nose and ears become cold to the touch. The skin may appear pale, bluish, or mottled, particularly around the fingers and toes. These changes can be startling, but they are not unusual. They are the body's way of conserving energy and focusing on essential functions. For family members and caregivers, watching these shifts can be both frightening and emotionally overwhelming. It's natural to want to intervene, to encourage them to breathe more deeply, to call the doctor, or to believe that urgent action is required. But in most cases, these changes are not medical emergencies. They are part of the gradual and natural process of dying. At this stage, the goal is not to fix the breathing or restore perfect circulation. Instead, it's about easing discomfort and creating a peaceful, reassuring environment. That might mean keeping the room cool and quiet, using a humidifier to moisten the air, offering small sips of water or ice chips, or using oxygen therapy if prescribed. Gentle repositioning can help ease labored breathing, and sensory comforts like soft lighting, favorite music, or a familiar scent can provide a sense of calm and safety. If your loved one is able to communicate, listen closely to how they describe their experience. They may not be afraid of what's happening, they may simply want someone nearby. Even when words are no longer spoken, your calm presence, soothing touch, and quiet reassurance can offer more comfort than any treatment ever could. When you notice major changes in your loved one's breathing or circulation, take them seriously, but don't panic. These are signs that the body is beginning to let go, and while you may not be able to stop the process, you can absolutely shape the experience. You can choose to fill this final stretch with reassurance instead of fear, presence instead of panic, and love instead of urgency. Because in the final chapter of life, what the body needs most isn't intervention, it's comfort, dignity, and the deep knowing that they are not alone. As we wrap up this video, I want to leave you with this simple truth. The end of life doesn't always come suddenly. Sometimes it arrives quietly, through gentle changes in the body, the mind, and the spirit. And when we learn to see those signs, we're not just preparing for death. We're preparing to live the final chapter with more love, more presence, and more peace. Recognizing these signs doesn't mean giving up hope. It means shifting your focus from trying to fix everything to simply being there. Sometimes, the most powerful thing you can do is sit close, listen fully, and let your loved one feel safe, valued, and not alone. If this video helped you, or if you're walking this journey right now, I encourage you to subscribe to this channel. We're here to talk about real things: aging, caregiving, and how to face life's hardest moments with strength and heart. Click subscribe, tap the notification bell, and join a growing community of people who care just like you. Thank you for watching. And whatever stage you're in, remember, you're not alone. We're in this together.